Good evening, doctors. Welcome again. Our today's topic is OCD. This is OCD. This is obsession, this is compulsion, and this is disorder. What is obsession? Obsession. Obsession means thoughts in a mind. Think about your hands are dirty and your dog is locked or not. These are the thoughts like door locked, checking. These are the obsession. And if you watching the door that is already closed, or you're washing your hands or taking a bath, this is compulsion. Compulsion is an act. This is an act. When you generate any kind of thought in your mind and you follow the step, this is normal physiologically, but pathologically, if you lock the door, you came and sit and you again think I haven't locked the door, again go check and sit, again go checking and sit. This is very much depressive. You already wash your hands, then again washing your hands till 1 hour 2 hours. Then if you are going in a bathroom, you are taking a bath, your whole tanks are empty. I have such patients. Obsession and compulsion disorder. If such thoughts develop in a mind, a patient knows very well it's neurotic symptom. He know he has a disorder of such things. Repeatedly these thoughts are in a mind, and if he is have obsession and he is not following the instruction, not doing that thing, it causes anxiety, severe tachycardia, and depression due to increase in serotonin hormone, in this condition. So in OCD, patient need to treat with psychosurgery or by SSRI. Drug of choice here is fluoxetine is a drug of choice, 10 mg 20 mg doses you can adjust according to the patient, and the treatment going around nearly 2 to 3 months. In some cases it is 1 year, or in some cases it is prolonged, depends on situation. And this OCD criteria, if you have such symptoms more than 2 weeks, this means it is suffering from obsession compulsion disorder. So many patients are suffering from this disorder. I am watching such kind of patients also. They have such problem when they are going to washing their hands, they have such disorder. They have money or not, checking, counting money repeatedly, so many things, knocking the door. They have, when they visit somewhere, they think the door is closed or not. They are feeling this themselves, they are a dirty hands, everything, because such episodes happening after some serious situation also, because some stress also. There is some reason behind, or sometimes it is idiopathic, no cause. So always treat the cause, guys, here. Thank you. That's all for today. Have a good day. Goodbye. If you have any queries regarding this disorder, you can ask me. Thank you and धन्यवाद.